Good morning, everyone. I'm Michael Bowdery. I'm Head of Programmes, Health and Care Research Wales and Research and Development Division, Welsh Government. And I'd like to welcome you all to the second session of the conference, New Initiatives in Research. Health and Care Research Wales has invested in a number of exciting new initiatives over the last year or so. This session showcases some of them and provides an opportunity for you to hear directly from those leading them. As you'll see and hear, the initiatives featured today span the breadth of the Health and Care Research Wales remit, which I hope will make this a particularly engaging and interesting session. Please feel free, well, in fact, we'd encourage you to tweet during the session using the hashtag ResearchWales21. We've got 3 presentations and something of a bonus video for you. There will be some time for questions after each presentation, so please do ask questions throughout the presentations by clicking the Ask button next to Have a Question on the right of your screen. And you can also vote for your favourite questions asked by others, and I'll try and pick out the most popular for the speakers at the end of each presentation. And just for the speakers, I'll stop you at around about 12 minutes just to make sure we've got time to get a few questions in. So without further ado, I'd like to introduce our first speaker, Professor Donald Forrester, who's Director of the Cascade Centre for Children's Social Care at Cardiff University. Cascade carries out extensive programmes of research in this field and is one of the largest centres of its kind in the UK. It's also home to the Exchange Network for Research Engagement in Social Care across Wales. Professor Forrester's research interests focus on understanding what good social work is and evaluating the difference it can make. He's here today to tell you about a Health and Care Research Wales funded initiative that he's leading to help build academic social capacity in social care research. Thank you, Donald.
Thank you very much, and thank you for giving me both the money to do the project and also this opportunity to share where we are now. The project is based within the Cascade Partnership, so that's the Cascade Centre, which is focused on children's social care, but we work with the SAIL data bank in Swansea, the Centre for Trials Research and the School of Psychology to sort of bring an interdisciplinary approach to working with children's social care. I'm afraid, because I'm not fantastic with technology, I'm using a rather old-fashioned method with my slides, which is to just ask for the next slide, please. So the project I'm going to talk about is focused on developing social care research capacity in Wales. It's a 3-year project and we're just at the end of the first year now. And I should say, while I'm the lead for the project, all the hard work is being done by Dr. Martin Elliott, who's so the good stuff that I'm going to be talking about is down to him. Next slide, please. I don't have long, but I'm quickly going to sort of outline the problem because I'm aware we'll be all sorts of different people here from different backgrounds, and you may or may not sort of know much about social care. A little bit about strengths and opportunities. Then I'm going to talk about the programme and what we're trying to achieve, and then I'm not sure how wise this is in front of the funder, but I'm going to give an honest appraisal of the first 12 months of things that have gone well, things that are maybe more problematic, and indications for the future. But particularly with the things that we're struggling with, which are, for instance, I'd say particularly around how we get more done in adult social care, I really value the thoughts or comments of anybody in the audience, or questions or ideas. So next slide. I just wanted to give people some indication of how big adult and children's social care is, and I literally just went to Google and picked off some random facts because they kind of make the case so well. So there's over 125,000 people receiving adult social care services in Wales. There's a very large number of children also involved. More than 1% of Welsh children are in care, which is one of the highest rates in the world. I think possibly the highest rate. But that's just the children in care. You have several times that having a social worker at any time, and a very high proportion of children will have a social worker by the time they reach 18, or have had a social worker by the time they reach 18. It's a massive employer. I couldn't find the figures for Wales in my quick search, but there's 1.2 million people working in adult social care in England. And expenditure in England is over 23 billion for adults and over 9 billion for children. So 32 billion, which is an enormous amount. In fact, it's so much, it's almost as much as the track and trace system. So it's a very, very substantial sector. Next slide. However, historically, it's been one that has had chronic and really massive underinvestment in research about what works and what makes a difference, and research really of any sort. So just over 10 years ago, some analysis was done by the Joint University Council for Social Work, which estimated that for each person working in health, over £3,000 per year was spent on research evaluation and related activities, and the figure was £25 for each person working in social care. But if you calculated it as a percentage of the money spent, it was 5.3% in, or 5.4% in health and 0.3% in social care. Even if you think that health's not the right comparison, the government guidance at the time was that most industries should be thinking about investing at least 2% into research and development. So 0.3% is a long way from the type of investment that was meant to be happening. In the last 10 years, there has been substantial change and substantial improvement in that we are now beginning to see an attempt to address that long-term underfunding. So we have the biggest single investment is the NIHR, National Institute for Health Research School for Social Care, which has seen tens of millions of pounds invested in mainly in England. We have Healthcare Research Wales investment in social care, such as the infrastructure funding that is supporting the Cascade Partnership and the social care fellowships. More recently, we have the What Works Centre for Children's Social Care, which is seeing tens of millions of pounds invested into the sector. And we also have an increasing sense that funders like the ESRC, that's the Economic Social Research Council, NIHR, other calls and others are identifying the underinvestment in children and adult social care and beginning to put money into it. Next slide, please. However, there's still a problem, and it's a supply problem, which we're all becoming kind of familiar with, which is why I use this picture. So metaphorically, there's a lot of demand, and we can see we're familiar with demand for petrol, and we actually have more funding available. But I think there is what we might call a supply problem, which is really getting good quality research done with the funding that's available, and getting it out there to make a difference into the sector. The underlying reason for this is if you chronically underinvest in a sector for a long time, you will have such problems. But the question, I guess, is what should we do about it? Next slide. So there are particular problems with a lack of high quality research leadership. So in terms of methodological abilities, whether it's been identified there aren't enough senior leaders. It's also a very aging workforce. I remain one of the youngest professors of social work in the UK, and without revealing my age, I shouldn't be one of the youngest ones. There should be many younger coming through, and there are relatively few. And that is because long term there's not been investment in this area. There's also things that may resonate with health, where it can be difficult to get practitioners to move into the academic world. That can partly be motivation. People go into social work or related professions because they want to help people, not usually because they primarily want to be researchers. It can be about expertise. Have they actually got the research know-how? It can also be practical know-how about how to become an academic, which can often be rather obscure, and people, it's not always clear how you do it. And there can also be problems getting more academic people to focus on social care. There can be a lack of interest where it's thought to be too pragmatic, too policy related. And there's also, I think this is more fundamental, sometimes a lack of understanding of key questions. So practitioners actually understand the questions that need to be asked, but may lack the methodological know-how to answer them. The methodologists often don't understand really the key questions in the sector and what's important to the people delivering services. So next slide, please. So this creates a series of problems in how we develop capacity for social care research. So next slide, Matt. Brilliant. Because the next slide is my picture of a pipeline. What we tried to do is, within the Cascade Partnership, we wanted to use the fact that we're a leading centre for social care. We've got a network across Wales with the Exchange Network. Wales is relatively small. So if we think about the pipeline of talent coming through to deliver social care research, could we do something to sort of metaphorically fix the holes? And to do that, next slide please, we identified in a relatively small project 3 areas where we wanted to make a difference. The first was a pathway to PhD, supporting more people to get into PhDs. Second, what we're calling pathway to PI, so it's helping people to get their first or an early or their first large grant. And in this, we've been supporting people to develop fellowships and current bids to the Healthcare Research Wales, but then we're going to target other funders. And then we have pathway to future leader, which we've started to call pathway to professor, because PhD, PI, professor, we like a bit of alliteration. Next slide, please. So thinking about how it's going, I think progress in getting more PhDs is relatively slow. That's partly about when we started, but it's partly because getting people to commit to a PhD often is about planting seeds, developing them, having conversations over a while. And also perhaps because we're starting from a relative position of strength. We already have quite a few PhDs in place, so perhaps we're already moderately good at that. I think support for bids has been very strong. We supported 3 bids that were successful to the fellowship scheme last year. We're supporting 8 or 9 to the current bid. So it's very strong in relation to children's social care, much less so in relation to adult social care, even though we have tried through the Exchange Network to publicise things. We haven't had much success in that. We've also are now working with 4 mentees who want to develop research leadership skills. So that's pairing them up with a senior academic who provides tips and support and coaching about how they can develop. That is more mixed children and adults, and I think that element of it is going particularly well and is being particularly appreciated. So next slide, please. We've also done some other things. I guess the first one was part of the proposal, which we've created a series of research masterclasses which are aimed at helping people understand particular methods that can be used in social care. So that we've had some very senior people come in and talk about their research. We've used that to engage some people who may be interested in practitioners or early stage researchers, and we've videoed it, and we'll be sharing, have been sharing, but I'm going to share more widely that resource. So that's a great resource. But then I think there are also things that have come up that we weren't expecting that have a lot of potential. One of them is through the mentee scheme. What becomes apparent is not everyone all across Wales has the sort of research intellectual support to develop research that we're fortunate enough to have, for instance, at Cascade. So we're in discussions with individuals about developing hubs or how we can support or work to create networks of expertise and share ideas, capacity. But a lot of what happens in a research intensive centre or network is you have more senior people to look at your ideas, at your bids, to give you feedback, and can we create more of a network across Wales and take advantage of the fact that Wales is not the biggest place in the world to sort of make us nimble and share some of that. So we're beginning discussions about that, which was not part of the plan, but I think would be a really good initiative. And then we've also been approached to possibly lead or certainly be involved as a key element of a very large grant application for about, I think, £8 or £9 million to support capacity development in social care across the UK, which relates back to the sort of issues I started with and about how we can address, in particular, the lack of quantitative capacity. So a lot of social workers, for instance, as lead people in this area, often want to work with people. Many of them are less interested in numbers, yet the questions they want answered about what works, for instance, often require quantitative knowledge. Final slide now, I think. I think addressing supply chains, I mean, I said turns out to be quite complicated. We knew it was quite complicated, and I think what we're doing here is trying out some approaches in the hope that some of them will work, and we may develop others as we go along, and it will be helpful to do so. I think it's been a very promising first 12 months with a lot of positive outcomes, particularly in relation to children's social care, which is obviously Cascade's strength. Less so in relation to adult social care, and I think there is an issue about how we can support or develop adult social care across Wales. But there's obviously much more to be done. This is just, it's not exactly the beginning, but it's just a small part of a potential solution to a complicated supply problem. So I think it's been a really great first 12 months. I hope that's given a flavour of why we're doing, what we're trying to do, and some of what's come out of it. And I am going to finish now, and I think I'll hand back to Michael, but I'm very open to questions or comments.
Yeah, thank you, Donald. We do have one question already. I've got one myself, and everyone else listening, if you have questions, please put them in now. We have about 2 or 3 minutes. But Donald, we have a question about barriers to social care practitioners becoming research active, and how you think those barriers can be addressed. Do you have any thoughts on that?
Yeah, well, so I think there are multiple barriers. A simple one is you know, if you've been in your profession for a little while, you're probably earning a moderate amount of money, and then do you want to? I took a £10,000 pay cut to go and do a PhD, and many people are not able or willing. I mean, that was relatively young, so there are some that are more difficult systemically. But I think the ones that are easiest to clear are the ones we're trying to clear first, which are about sort of know-how, about opportunities, about ways you can make it work, about the fact that we want practitioners to come and become skilled researchers, and that they offer something because of their practice experience. So it's not, I don't think, a coincidence that my father was a professor. That then gives me a sort of know-how about how the academic world, which works. That meant I went and found out how to do a PhD. People from less privileged backgrounds just don't know about those sort of things. So to some extent, just letting people know what the options are, talking to them, understanding what their needs are, is the first step. But actually, we also need to understand barriers from the perspective of the professionals themselves. So it'd be really interesting to hear what people have to say about that. So we probably can't do it in this discussion, but if anyone wants to email me any thoughts or ideas, or you're interested in developing research or a research career, we're absolutely really committed to supporting that.
Great, thank you. I mean, your initiative, when you've been talking about, focuses on PhDs, I know, and relatively early stage career development. We have a question here about professors of social work. In relation to the supply problem that you outlined, I guess. And the question there is it really, when you're talking about professors, all about supply, or is there a challenge in the universities?
There are challenges in the universities, which are, there's complicated challenges in the universities, but I think that there's primarily a demand one. So I'm aware of many professorships, or quite a few professorships that have been advertised and have had nobody they felt they could shortlist, for instance. When that happens, it's an indication of a supply side problem, but it also makes social work vulnerable within universities, because if universities feel we can't recruit good people, we can't recruit leadership, then those units or teams or whatever become vulnerable. So I think if we can address the quality of candidates, it also helps to address potentially the vulnerability of social work within some universities.
Okay, thank you. And we got time just for one more quick one, which is, how might research-interested charities play a role in identifying or promoting research?
Well, I don't know. Well, that's it. I don't know the answer to that question, but we would be really interested in having conversations with charities that want to do that, because I know some, for instance, we do quite a bit of work with Barnardo's, and that I think contributes to. I think they have a strong research culture, and I hope we contribute to that. But we'd certainly be looking to support any charity, and I know many charities are a lot smaller than Barnardo's, but could we work more effectively with them? I'd really be interested if anyone from any charities is interested in developing their research use or coverage or capacity, and we could talk about how we might be able to support them.
Great, thank you. And I think the same would be true in general from a Health and Care Research Wales perspective, that we're always looking to engage with research charities, and in fact some of the things we'll come on to now speak to that. Thank you very much, Donald. Contact details for the speakers presumably will be available. I'm sure we can make them available to those asking after the conference, so you'll be able to follow up with the presenters. Thank you very much, Donald.
Thank you very much
for all your questions. And if I can move on, and in fact, this is our next speaker is Professor Chris George from Swansea University, and this was an example where Health and Care Research Wales did in fact work with a research charity, not in social care, but the British Heart Foundation, to explore the possibilities of investment in something in Wales that would try and grow cardiovascular research, give it a boost, while also addressing some of the strategic priorities that BHF have as a funder. Chris is from Swansea University's Medical School. His own research explores the behaviour and predictability of networks of heart cells in response to genetic mutations and drugs. He has received grant funding from the BHF, from BBSRC, from the Wellcome Trust, the MRC and the European Union. Chris is a senior editor of the British Journal of Pharmacology, with responsibility for the journal's cardiovascular portfolio. He's also a member of the editorial board of Cardiovascular Research, Frontiers in Physiology and Artery Research. He sits on the board of the National Centre for Replacement, Refinement and Reduction of Animals in Research and chairs its grant assessment panel. So I feel now, having read all that, that we're in the presence of cardiovascular research royalty. That suggests to me that we made a good choice in asking Chris to lead the National Cardiovascular Research Network, and he's here now to tell you more about it. Chris.
Thank you, Michael. Very kind introduction. I'm delighted to be on the call this morning to share some background and context to the building up of what we've termed the National Cardiovascular Research Network for Wales, and give you some idea of why we've chosen to do it in the way that we've done with that introduction in mind. Okay, so it is true to say that cardiovascular disease across the UK, more globally generally, is at truly epidemic proportions. The last 18 months have given some real context and insight into people's use of the terms pandemic and epidemic, but the numbers for cardiovascular disease globally and specifically in the UK are really extremely high. I'll just orientate you to some of the numbers that are given in this slide. Around about just under 1,000 people die from cardiovascular disease each month, and the incidence across the population is close to 300 per 100,000 people. And you'll see from the map given on the right-hand side of this slide that there are sort of some really quite infamous hotspots of cardiovascular mortality. And I happen to be speaking to you this morning from Swansea, which is one of those such hotspots. Now, this slide is quite misleading, deliberately so, because the number of deaths from cardiovascular disease are actually decreasing over time. And that sets up a really critical healthcare problem, that more people are living with an extremely poor cardiovascular prognosis, this phenomena of living unwell. And so there is a real need to develop new therapeutic approaches to cope with the demand for cardiovascular therapy within the population more generally. So in 2018, when we were discussing with Health and Care Research Wales the need for a coherent framework to develop research in and around cardiovascular research and comorbidities, I titled the slide sort of the need for coherence and cohesion. Because there is a perception, and some of the points that I put on these slides I don't necessarily agree with, but this is certainly one that I do, is that Wales is home to really world-leading cardiovascular research groups, but the research environment more generally is very small and is fragmented, and that's critically given by a low critical mass. There are not many people working at the coalface of cardiovascular research in Wales, given the healthcare burden of cardiovascular research in Wales. There's this sort of disconnect between supply and demand, something like Donald was talking about in his earlier presentation. So one of the problems in terms of the Welsh ecosystem around cardiovascular research is that cross-institutional interactions and interaction with the surrounding local health boards are not as well developed as we like. And again, there was this phenomena of disconnect between supply and demand. So I've put this point as poor articulation. If I was being less kind, I would say there was no strategic vision. And so I think one of the aims of the network that we were trying to push forward with was to get a much better articulation of what the strategic vision for cardiovascular research in Wales was, specifically oriented at the funders who were looking around at what Wales was able to deliver. And I'll come to talk about that more generally later. So we lacked a real framework for mapping research activity across the piece, and also, and importantly, a mechanism for galvanizing new, more ambitious, larger research projects around cardiovascular disease that took in the laboratory and the clinical aspects and allowed those environments to mutually inform each other. And part of the perception, and again, I'll raise this issue of how the external funding landscape perceived cardiovascular research in Wales, was that a lot of it was happening, but a lot of it was happening in a relatively informal, non-funded way. And it was happening off radar. It was going on, but not many people knew about it. So that's kind of the context of the problems that we need to fix, but that shouldn't undersell the real opportunities that we have and the basis for pushing on very, very strongly. So there are clear and evident recognised strengths and very substantial funding track records in focused areas of cardiovascular research that lend themselves naturally to very strong thematic development. Wales is home to really global leading activities across multi-scale knowledge. And with my sort of perspective from the external funding landscape, the multi-scale nature of research is really going to be underpinning the next sort of decades of pulling together the pieces of research jigsaws. And so just to give you a little example, you hear very commonly in the press the translation of work from molecule to man. Equally important is the translation from man back to molecule. And so by these sorts of trajectories of going from molecules to signaling cascades through cells, how cells build networks, how networks build organs, how organs are assimilated into physiological body responses, and how the response of the population more generally to those mechanisms, that sort of additive, cumulative scale of knowledge is essential to developing the next generation of drugs and the next generation of clinical therapies. And we're very good at that in Wales, but what we're not good at is necessarily linking those stages in a coherent narrative. So Wales, from a genetic and also from a healthcare perspective, offers a quite unique demography that we really should be in prime place to develop further with the external environment in mind. And so we offer quite an enviable landscape. My colleagues across the world are very envious of the way that Wales presents a really quite unique perspective to study disease-causing pathways, to look at patients in society. It's a relatively non-migratory society that lends itself to detailed clinical study, and also to very nicely position gaps between evidence and best practice in clinical medicine. So we have some real advantages that just need the environment to be sort of brought to bear at answering these very key questions. So the mission statement of the network, which, as Michael alluded to at the start, represents a really strong partnership between Health and Care Research Wales and British Heart Foundation, who are the leading funder and the dominant funder of cardiovascular research in the UK, is effectively to provide a focused translational pathway in which mechanism-orientated scalar research in laboratory, in vitro, in silico can translate through to demonstrable clinical benefit in the patients of cardiovascular clinics. And we've chosen to do this by, as I say, focusing on areas of strength. That these are three research areas that would be recognised globally as being Wales's strongest offering in terms of cardiovascular research. Its new stratified approaches to tackle arrhythmia, cardiovascular healthcare outcomes and data science, and also translational vascular physiology. And we're very deliberately rooting our endeavour in driving the research agenda. because it's the research that will lead to the next generation of help for clinical patients, the benefits of patients in society. And we recognise that these three research themes already have rather obvious areas of strength within themselves, but it's the ability to harness those to spin off other new research endeavours that offer true complementarity between these research pathways. So just to give you some flavour, we have developed very specifically project-focused offerings around inherited cardiac conditions, stratified medicine, coronary heart disease, health outcomes. I list them here on this slide, but we're very keen that the network is taken forward with a thematic organisation that maps to a position of strength and somewhere where we can demonstrably compete and lead globally. So, of course, one of the issues of cardiovascular is that it touches on the edges of a number of other really quite striking comorbidities, specifically the cardiovascular component of vascular dementia, of stroke and diabetes and kidney. And we're working with other researchers within the Welshscape and beyond to develop the links between these three research themes, which again, I'll reiterate, are being built from a position of strength, reaching out into these other comorbidities to galvanise the kind of research power that we have here in Wales. So the activities, a lot of this is motherhood and apple pie. What are we doing? We're increasing the number of publications. We're increasingly getting better levels of grant capture into Wales, but we're also considering things like innovation and engagement, how to build a base. Donald spoke very articulately about the leaky pipeline. How do you pull and how do you corral all of the activities through a pipeline of development? And that's something that is absolutely key to the way that we're doing it here in the NCRN. But there's clearly a need to develop and enhance interdisciplinarity. And so these sort of twin peaks of myocardial disease and vascular disease cross-cut with discipline-specific expertise in data science, population health, computational biology, and also engineering principles of cell systems are something that we're harnessing, all leading towards this kind of pinnacle of improved clinical trials and patient innovation.
You're nearly out of time, Chris.
Thank you. I'm on my last two slides. So we're doing this across all of the health boards in Wales. We've currently got engagement with 86 PIs and more than 300 researchers. And the network is being run in a series of working groups, advisory sectors, and an executive to operationalise all of the structure. So what are we achieving now? And within the last 12 months, what we've done is to clearly improve lines of communication and enfranchisement of the community of cardiovascular researchers and clinicians. We have a demonstrably improved visibility and profile of cardiovascular research already in Wales, specifically with external funders. And that has led to improved levels of funding already, and two notable awards recently into Swansea and Cardiff, built around mechanism research in cardiovascular arrhythmia, are really welcome and well-deserved. We're achieving the development of more ambitious and cross-discipline projects across the scales and across disciplines. And that leads us to now begin to scope what can we achieve in the longer term. And I think, put very simply, I think we're in an excellent place to develop the pipeline to translate cross-discipline work directly into patient benefit. But that will take time and that will take a lot of concerted effort. As Donald says, there is an awful lot more to do. But the barriers to this is an external research funding landscape which has changed beyond belief by the COVID pandemic. And we have to be nimble and we have to be very flexible about how we're going to continue to pull money into the NCRN for its continued development. And there are also challenges which we all recognise about how do you make these frameworks sustainable and how do you keep them self-sustainable for future development. And I think that's where I'm going to finish it, sort of heeding Michael's advice about making public our contact details. I would welcome all and any inquiries about the network. Here's the email that you can contact us by, and I'd be delighted to answer any questions. that you may have about it. Thank you very much for your attention.
Great, thank you, Chris. We are actually out of time for this session, and we have others to present. So, given that you've put your email address there, perhaps people could contact you directly with questions, or we can come back if we do have a minute or two at the end of the session. But thank you very much for that really clear introduction to the work of the network. So now we can move on to what I said earlier was a bonus video. I don't think it was on the advertised program. While most of our funding, our program funding, is just distributed via competitive funding calls, we do always look for opportunities to match funds with partners where initiatives meet the strategic aims of both funders and sometimes collaborations of more than two. And this is true of the programme of work we're co-funding with the Scarfree Foundation that's led by Professor Ian Whittaker. Ian is the Health and Care Research Wales Specialty Lead for Surgery. He's a chair of plastic surgery at Swansea University Medical School. Unfortunately, in true Oscar fashion, he couldn't be here with us today, but he has pre-recorded a piece just to give you a quick introduction to the work of Ian and his group. So if we can now play the video, please.
Sorry I can't be there today. I just wanted to thank Health and Care Research Wales for their ongoing support and their significant funding, which will be really transformational in developing the research group, helping recruit more staff and helping us refurbish a specific area in the Institute of Life Science at Swansea University, which is bespoke to our needs. This will help push us forward towards clinical translation of our 3D tissue engineering research, and also to help significantly impact and transform the care of skin cancer patients within Wales. Leecon Regen is a multidisciplinary clinical academic research group which is based at Swansea University and the Swansea Bay University Health Board. The major focus of our current research and this project is to 3D print tissue engineered cartilage for use in facial reconstruction, which will initially start in the paediatric population. 1 in 111 people in the United Kingdom suffer from a facial disfigurement. We hope that this research will help this patient group, which is both children and adults, which suffer from defects either that they're born with or they have through trauma or cancer.
10-year-old Radia from Milford Haven was born without a properly developed left ear. She hopes to one day benefit from this research.
It'll be a positive change for them because, girls like to pierce their ears, tie their hair back, and if they have 2 matching ears, it'll be very positive in their confidence and in life.
Over the past 7 years, the group has developed into a critical mass of clinical academic researchers with high-quality scientific collaborators in a strong 4-star research environment, producing high-quality publications and advancing knowledge in the field of reconstructive surgery. Our previous work has highlighted a promising cell source and a novel, natural, printable bioink which holds great promise for clinical translation. As a result of this work, myself and the team have been fortunate to receive numerous awards from professional bodies and research councils, which has allowed pump priming of our research and also the opportunity to travel overseas to experience world-class, cutting-edge clinical and scientific work. Plans over the next 12 months are to follow the 3 key work streams of optimising cell growth, strengthening the bioink, and testing the safety and durability of the 3D printed construct in laboratory models. The long-term impact of this work will be really significant. We will no longer have to rob Peter to pay Paul as surgeons. We'll be able to grow our own tissues. We won't be forced to remove it from elsewhere, which causes scarring and pain. This will be a transformation in personalised treatment options and will truly rewrite the future of surgery.
Hello, my name's Professor Hayley Hutchings. I'm a Professor of Health Services Research at Swansea University and I'm Co-Director of Swansea Trials Unit. I've been working with the Leecon Regen group for many years now to develop various research ideas around skin cancer and facial reconstruction. We're delighted that we've received additional funding from Health and Care Research Wales and Scarfree Foundation to help further develop this work.
The aim of the RESECT project is to establish a comprehensive national overview of the nature and state of care currently provided to skin cancer patients across Wales. By taking a data-centric approach, RESECT will provide the evidence base required to inform effective service redesign for better patient outcomes. This Wales-focused project aligns closely with the research imperatives of Health and Care Research Wales, specifically in supporting work that serves the Welsh Government's policy of prudent healthcare and which has the potential for real long-term impact. The EFFECT project will assess the burden of facial scarring and associated mental health conditions to identify the patients at greatest risk.
You can see I have no ears, or very little ears. The skin on my nose comes off my bum. Those were surgeries I had to have, but they couldn't replicate what I needed when I was a younger man. I don't need it now. I've got used to my glasses falling off. You know, the fact my nose doesn't sweat because it's a skin graft. But I've got used to that. But for younger people, had it been available when I was younger, it would have been absolutely crucial.
Great. Well, thanks to Ian in his absence. And moving swiftly on, because we are running a bit short of time, can I introduce Professor Charles Musselwhite and Dr. Sarah Jones, who are co-directors of the Transport and Health Integrated Research Network, or THINK. I'll leave it there, Charles, so you've got more time to talk.
Hello there. Hi, so Charles and I are here today to talk about the Transport and Health Integrated Research Network, THINK as we call it. We're going to do a bit of a double act. I'll start off and then Charles will tell you in a little bit more detail about what the project actually is. But to start off with, I'm going to give a little background into why we need this, why we need THINK, why it's so important right now. Charles will tell you a bit more about the specific topics we're interested in and then how actually we're going to manage THINK and actually bring about change in terms of the integration of transport and health. So where we're going, well, we've had roads for 12,000 years. They're not new, but what definitely is new on them is the presence of cars. So in that 12,000 years of roads, we've had masses of advantages. We've seen trade, development of communication, but we've also got huge numbers of disadvantages which go with roads, and particularly the presence of cars on them. In fact, in the past 150 years since cars have been on the roads, we've seen an explosion in the disadvantages that go with it. And what you see there with the blue bars is the proportion of time that we've had roads before cars, and then the tiny red blob at the top of it is the car proportion of road time. And when we look at the disadvantages that have come about since cars that have joined the roads, then it really is quite a staggering change. What we saw in the beginning was roads were a public space. Everyone had a right to use all the parts of the road, including children at play. In 1896, we saw the first death on UK roads, and the coroner at the time, when he carrying out the investigation into that death, and the coroner's report stated that such a thing should never happen again. It was perhaps the least insightful remark ever made by a coroner, since in the time since that death, there have been roughly 500,000 deaths on UK roads, and that's just from road traffic crashes alone. That doesn't get into the type of physical activity, air pollution, and the whole variety of other problems that go with our road space and the intrusion of cars onto that. The response of policymakers and the media in particular to the increasing number of road deaths was actually, in the first instance, to refer to them as road killings. The media talked about road killings and called for action. But of course, there was a lot of investment and economic development that was associated with the building of cars. And the realization came that actually we needed to keep the cars, and the safest way to deal with roads was to move everybody else out of their way. We saw efforts like this in America, which basically told pedestrians that the space where cars went was for cars alone. A big shift from that idea of roads being a place where everybody had a place. And from there, then we saw a real shift in the way we regarded car use on our roads. It's very true of the day to day. You shoot someone and you kill them, it's murder, and that involves a significant jail sentence. However, we routinely refer to the incidents that involve cars as accidents, which implies we can't do anything to prevent them, and they're actually okay and perfectly acceptable for society to deal with them and manage with them. It's nobody's fault. We also routinely only refer to cars hitting pedestrians and not the driver as having any contribution to that. But the injuries, as I say, that are associated with road traffic are just a very, very small part of the health harms that road traffic causes. It produces air pollution, it increases social isolation and loneliness, it encourages physical inactivity, creating noise, exacerbating inequalities, and of course, causing that significant number of road traffic injuries. Charles, I'll pass over to you.
Thanks, Sarah. So I get the nice job of being able to tell you about how we're setting up the new network. Delighted to be able to have funding. So thank you very much to Health and Care Research Wales, and hopefully we'll be able to do really good things. I think the first thing Sarah and I identified with the network was the need to create a space for people to come together. So a space for people to come together from different disciplines, different backgrounds, from policy and practice, from third sector and charities, and also different disciplines within health and different disciplines within transport practice as well. There's lots of people who know about the health harms from transport, but there isn't very many people always working in practice in those areas, and there isn't a great space to do that. So that's what we're going to try and do. And really building on what Sarah said there's the 4 areas we're going to concentrate on. So direct harms from pollution, the road traffic casualties and injuries, reduction in active travel, and one additional one that I think is really important, that's often underplayed, and that's community severance. You know, we talk a lot about how cars join people together, allow people to live far away from each other but still see each other, but it comes at a cost to the immediate societies. Example on the picture there, you can't see very well, but of Port Talbot and the M4 and how that slices those communities in half. Cross-cutting themes within all of that, and you can see some of that detail on there, is very much about deprivation. People from the sort of poor areas much more likely to have higher health harms than those from higher areas for all sorts of different reasons, and that needs concentrating on. And we're going to take a life course perspective because people face different vulnerabilities at different stages of life. So young children, young teens in terms of road collisions, and again older people in particular, issues around that, as well as looking at vulnerable road use as well. So walking and cycling, the active travel elements are key to that kind of area. So we began to map out some potential research avenues for Think. The first 2 on the left hand side there are really looking at interventions that can be placed into the public realm, if you like, to try and improve the relationship between people's health and mobility. So, for example, increasing active travel, increasing public transport, making sure that happens equitably, 20-mile-an-hour default speed limits, the potential that has to work across all those 4 different domains. And also below that, I mean, something that came out very clearly from a lot of background of this kind of research, Harry Rutter speaks very well about this, professor of global public health at Bath University. You know, that it's no great surprise to us in the field, but still needs lots of research. We kind of know what the relationship is between the harms of the road and poorer health, But what we don't do is act upon that. And so lots of research needs to be done about acceptability of the public in terms of these interventions, acceptability in terms of politics, and how we implement some of these interventions is crucial to that. As well as looking forward, those top two elements on the other side of the slide there look at future innovations, some of them about now, but we can't ignore those. You know, lots of those are dreamed up by brilliant technologists, brilliant engineers, but what is the impact on that to people at the end of the day, and particularly into people's health? As well as I said earlier, you know, inequalities comes out right across the board on this. And, you know, the added element of doing this in Wales means rurality is a key issue as well to look at within this. We began mapping out some potential projects for Think, particularly looking at complex system evaluations. Bringing people together from lots of different disciplines allows us to do that. Looking at big data sets that we've got in terms of things like you know, road collision data, but bringing that together with health data would be really useful to do. That idea of bringing together tools, products and solutions to help people make proper choices and politicians make proper choices about healthy transport, looking at how that's, for example, cost benefit analysis, social return on investment, that kind of thing, as well as looking at strengthening existing connections as well between those different partners in research and how we do that kind of element and allow space for that to happen. All in all, overarching that, trying to keep this network going in the future as well. So looking for funding around those kind of things. But it's not all about research. Research is really important, but I think all of the groups today have mentioned, you know, different elements of being at capacity building in some respect. Like I say, this is a network, so it's about bringing people together, offering space to develop research, but also getting that research into practice. But we've also come up with two additional arms on that. So we've called the research element the Think Foundry. We've got an element about educating practitioners working in this field, the Think Academy, and we've got an element of integrating things together and getting people to work together that we've called the Participate part of the project. So, you know, the Academy is about offering skills in terms of research skills to people working in this field. It might be about providing easy to access one-page summaries of the key findings, as well as helping in a bit more detail get the findings into policy and practice. The integration of Think Participate, we really want to offer small projects to allow people to come together. So secondment opportunities from people in research to work with people in practice, and the other way around. So visiting practitioners to come and work with researchers, as well as interactive roadshows with the public to try and garner support for, you know, why are people so against, for example, 20-mile-an-hour speed limits, where it's not going to make huge difference to people's travel time, not going to make huge difference to people's freedom. You know, those kind of elements can be picked up with more detailed work with the public, I think. So, like I said, partnership working is crucial to this. These are some of the partners we've got at the moment from different agencies, different organisations, businesses, as well as academia, and therefore, you know, to try and create that space to bring people together and turn things into reality. I don't have much detail of where we're up to in terms of our vision so far, because we're right at the start of this network. In fact, on Friday, we advertised for a researcher to work with us, and we've advertised for a project officer to come and work with us. So we're right at the start of this. So our vision may look quite bold and a little bit frightening for us at this stage, but there's no reason not to have those kind of things thinking about moving forward. You know, we want to make Wales a world leader, if not the world leader, on integrating transport and health. There's bits of this going on all out throughout the world, but it happens often in very fragmented parts. It's the network to bring that together that would really make a difference. And therefore, also in the green there, helping people of Wales by reducing the negative impacts by transport, really setting the agenda to improve people's lives and people's health within that. And of course, surrounding that, make transport and health a thing, an entity in itself that stimulates job creation, creates a place where we can really try and make a difference. So big, laudable aims, but underpinning that, and this is where we need the help of everybody watching at home. Do get voting for this, please. Put it in the chat function if you want, and help us. We need a better strapline than those lofty visions, if you like. So I think I blame Sarah on coming up with these so far. But you know, moving Wales well, moving Wales healthier, healthy movement, healthy Wales, healthy movement Wales. You know, what could we call? Pick one of those. Vote now. Put it in the chat, A, B, C, or D, or definitely come up with a better one if you can. We need some kind of strapline to underpin our research if we want to help engage with the public a bit better, I think, moving forwards. So who knows, it might be there for the next 3 years of the project if you're good thinking on this moving forwards. And I think that's really where I end. But like we said, and people have said before on their networks, do get involved. Do come and talk to us. We're right at the start. We've got some good ideas there, but nothing's set in stone. You know, it's a network. Come and join us. We're very happy to talk different elements of where we go with some of the ideas we've got. So basically, the message is just to get involved. And thank you very much for your time.
Great, thank you very much, Charles and Sarah. A couple of things I just wanted to add from a Health and Care Research Wales perspective. One is to make people aware that our support for Think has come from our involvement in the UK Prevention Research Partnership, the UK PRP, which is a cross-funder initiative focused on preventable, non-communicable diseases, with a focus on upstream determinants and multidisciplinary approaches, drawing people into the health arena who perhaps might not commonly or usually be there. And the other comment was just to say how exciting I think it is to have a Public Health Wales and university collaboration driving this work forward. We do have a question in I was just going to ask a question of my own. We do have a question from Kerry Hood. How can we ensure we balance equity of access for people with disabilities while changing how we travel?
It's a great question. Over to you, Sarah.
Thanks for the hospital pass, Charles. I think it's a real challenge, and I think it's definitely an issue that's far more topical than it's ever been before. And I think alongside the questions around equity of access for people with disabilities, we've got a lot more questions about, well, how do we integrate the transport network so that we can take bikes and pushchairs more easily onto the transport network as well as wheelchairs. So I think it's about taking all of those views as a whole, thinking about, right, well, we need space for wheelchairs, for pushchairs, for bikes. It's not one at the expense of the other. It's about equity of access for everybody, because the transport system is everybody. Let's go back to that original goal of roads being a place that was used by everybody. And we need to think about a transport system that does have space for everybody to use it, whether it's the bus, the train, the tram, or it's cycleways or pavements, or even roadways for cars, but a system that really does actually think rather than regard something that's not people on 2 feet as the norm. And I think that's one of the things that we're aiming for within our integrated network, is integrating everybody into the network as well.
Yeah, it's a case of something in the field at the moment called sort of transport justice at the end of the day as well comes into play. You know, it's about balancing people's needs and, you know, whose needs get looked after the most at the moment. It certainly isn't people with disabilities or it's not people who live in poor areas, or it's not people who live in rural areas. You know, at the moment we're really championing city centres, town centres, and people who use vehicles all the time. And of course, vehicles have given us great ability to connect across the world. We all, you know, have the positive side of transport, you know, and high accessibility. But what we don't do is pay enough attention to the negative side of things, and we need to draw attention to that and research that a bit more in detail, I think.
And I think, unfortunately, sorry, just to finish on that, and noting, with all due respect, gents, the rest of the speakers in this session, the transport system has historically been developed for men, and generally more middle-aged men, rather than everybody else who uses the system. And this is becoming increasingly recognised.
Great, thanks very much both. We are almost out of time. Apologies to everybody or anyone who's put a question have asked a question we've not quite got to, but hopefully you can follow up with people after. Thanks to the presenters for giving your time. It has turned out to be a packed session, hasn't it? And I think it has shown the breadth of the Health and Care Research Wales. Please bear in mind that this was intended to be a taster session, and we would like you to follow up, take advantage of that. There will now be a break until 12, at which point we will have the second plenary of the day on research, innovation and improvement, chaired by Jan Lawrence. Thanks to all for attending this session, and don't forget the hashtag ResearchWales21 for those of you who tweet. Thanks very much indeed to all.